Hi everyone. Today we'll be talking about traumatic brain injuries. We'll go over some background information before talking about defining features and how they manifest in the educational realm and strategies to support students with traumatic brain injuries. So a TBI is short for a traumatic brain injury, and it's defined as a head injury, a medical condition that occurs when an external force or trauma, usually an accident, causes injury to the scalp, skull, or brain. This can range from a minor bump on the skull to a serious brain injuries. And the spectrum of a traumatic brain injury ranges from mild sports concussion to a catastrophic event. TBIs are the most common cause of death and disability among young people. They occur in 85% of traumatized children, and the Glasgow Coma Scale, GCS, is used to determine the severity of the injury. This scale measures the responsiveness of the patient in the post-injury phase. Traumatic brain injuries are categorized as mild, moderate, and severe. Primary injuries is the actual trauma and caused by the initial trauma, the physical force that actually created the TBI. The secondary injury is what doctors work very quickly to stop, which is the result of the cascade events. This includes edema, which is the medical term for swelling, a capillary leak, which is the leaking of fluids into the brain, or the activation of the secondary inflammatory response. Effects in children. TBIs are particularly profound in children because they happen on a developing brain. Some children who have the injury as a child will not show serious effects until they're expected to show competence and independence in middle school and high school. So if a traumatic brain injury affects a 5-year-old's organizational areas, this might not become apparent as a problem until they are older and they are expected to have things organized and take more, show more competence and independence in these areas. So certain psychological conditions also may not show up until later. It's important to know when working with students if they've had a traumatic brain injury, because this may explain some of their behavioral or social changes. In the United States, 1.6 million people sustain a traumatic brain injury per year. The incidence of TBIs in children younger than 15 is 400 cases per 100,000 each year. So they're predominant in toddlers because toddlers have poor head control and their head is disproportionate to their bodies. They're also predominant in adolescents because of the high impact sports that teenagers often play, and the overwhelming cause of TBIs in adolescents is from car accidents. Males of all ages from birth to elderly are at a higher incidence for traumatic brain injuries. Students with traumatic brain injuries have been eligible for special education services since 1991. The National Center for Education Statistics states that 25,000 students in school year 2007 to 2008 were served by special education services for a TBI. Since the reauthorization of the Individuals with Disabilities Education Improvement Act in 2004, 0.4% of children 3 to 21 served by special education services have a TBI. So 0.4% does not seem like a lot, but it is a significant number, and it is a significant injury, even though it's not as common. As you can see, the educational definition of a TBI is very long. The educational definition takes into account a student's neuropsychological functioning as it's related to educational needs. Underlined are some of the impairments that may occur after a TBI: cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual, motor abilities, psychosocial behavior, physical functions, information processing, and speech. So it's not saying that a child who suffers from a traumatic brain injury will also suffer from all of these impairments, but likely at least one, more than two of these will suffer because of the TBI. It's also important to remember when working with parents that for the parents, this is often their first time dealing with the special education system, any of the language, and the parents are probably also grappling with the event that happened to their child, with the accident, and having a disabled child overnight. So where some disabilities from birth, the parents have had time to educate themselves and become used to it and make it part of their routine. With a traumatic brain injury, this happens overnight. Parents are often overwhelmed and confused, and it's important to have patience. Some of the academic challenges are listed with a traumatic brain injury. So it's often difficult for an educator to predict academic functioning after a TBI because assessments usually only assess the retention and recall of previously learned information. This means if a child sustained a traumatic brain injury at the beginning of 4th grade, she might remember all of 2nd grade and all of 3rd grade, and you would think that she's fine. But in reality, she will have trouble retaining information going forward because the achievement tests tap your pre-injury skills, not your post-injury potential. So it's not enough to rely on those tests to see if a student is going to be okay or see if their severity, because as time moves forward, they may start to exhibit a completely different kind of academic struggles than they've had before. Psychosocial challenges. A TBI can exacerbate a pre-existing behavior problem or result in a new behavior. And as discussed, these might not show up right away. Oftentimes the emotional effects like PTSD show up right after the accident, but effects like conduct problem, decreased motivation, frustration, anxiety disorder, these might not show up until months or even years after the event. This is a list of common issues post-traumatic brain injury. As you can see, secondary ADHD, anxiety disorder, PTSD, personality change. These are very common things that occur in people who have suffered a traumatic brain injury. Studies show that emotional issues also arise out of a TBI. There's a decreased ability to self-monitor and self-regulate their emotions. This affects academics, but this also really affects social relationships, especially for middle schoolers and high schoolers. Studies show that students with a TBI, when faced with emotional recognition tests, they'll make errors in both magnitude and valence. So magnitude is mistaking one similar emotion, like mistaking disgust for anger, but valence is mistaking completely opposite emotions. So they might be showing analysts may show them a picture of someone who's smiling, and the student will say that person's angry. So it's really tricky, and as we talked about, this plays a huge impact into their social roles and their social relationships. Outcomes vary from individual to individual, which is important to remember. No two TBIs are the same, and every student will have a different set of challenges and recover on a different timeline. Knowing the severity of a traumatic brain injury can help educators better predict the difficulties that the students will face. A functional behavior assessment is a great tool, and it's part of the special education evaluation. This will assist the team to help examine, measure, and treat many deficits associated with a TBI and can help set target behavior and interventions. Cognitive impairment interventions. This is just a list of a couple things that have worked. Using a timer to focus attention, earplugs, especially during tests. Students sometimes feel very distracted, so earplugs can help them focus. And rest periods. This can include rest periods from screens, from the harsh lights in the classroom, or rest period from work. This is a list of memory and organizational impairment interventions. It includes checklists, planners, and breaking a task into steps and reviewing your daily routine. So instead of overwhelming a child with a huge task, breaking that into steps, breaking the day into hours or even half an hour increments can really have a positive effect for students with a TBI. The goal, plan, do routine, behavior challenge changes interventions. So the functional behavior analysis research shows that most occurrence of challenging behavior is just from a need to escape. So most students will act out, they'll lose focus, they'll get really upset and aggressive because they need to escape the situation or the task at hand. So in counseling, showing how to replace those behaviors with positive communication can be very important, even so much as teaching a kid that it's okay to say, I need a break, and working with their teachers to let the teachers know that sometimes these children will need a break from schoolwork, they'll need a break from their overwhelming classroom, and it's important to allow them those breaks so they do not have a meltdown episode. Some anxiety management strategies: self-monitoring, individual and group counseling, and those social cognition skills for the emotional recognition ability that we talked about is really important. For the different grade levels, those interventions will be a little bit different. But once a child starts getting social counseling and individual counseling, when you feel it's appropriate for them to move to a group setting, that can really help their social skills. Now it's time for the Goal, Plan, Do, Review routine, which is shown to be a very successful intervention when working with students who suffer from a TBI. It helps with all of those impaired executive functions, and students start with kind of a graphic map that represents the sequence and flow. It can just be columns with arrows saying, what's your goal? How difficult is it going to be? What's the plan? What did you do? How did it go? And as counseling goes on, if a student is older, as they start to recover more, this can become more brief and formal and informal, and then collaborative with the counselor. Instead of writing out every goal, plan, do, review, it can be more of a conversation, a back and forth between the student and the counselor. This is also really great for daily check-ins. State TBI consulting teams is something that started in the state of Oregon and has spread to other states. A TBI consulting team model, it focuses on capacity building. So they're training educators, not people who work in rehabilitation settings or the medical world. So the educational personnel really learns a lot about traumatic brain injuries and how to treat and the good interventions for students as it relates to education. So the New Jersey actually has a bill, Bill 1024, currently in the Assembly Education Committee. This will create a traumatic brain injury education coordinator for the state, and then regional consultants that better assist schools and students with TBIs. This is, a process where all of a sudden a student has a traumatic brain injury, the parents don't know what to do, the counselors aren't sure what to do, the school nurse doesn't know what to do. So this person can come into the school and really get a team together and educate them. This is proven to work a lot better than those kind of one-day in-services. Every couple years someone talks and gives a presentation at a staff meeting and everyone's like, okay, and then they kind of forget. This is really targeted towards that team that'll be working with the child, of parents, teachers, the school nurse, and the counselors. This regional TBI consultants also give early access to needed resources. They can come out and do those professional development in services, but it's really great to have a whole kind of team atmosphere and a professional that's specifically trained to work in schools and work with education plans. So it's not someone throwing a bunch of medical information at you. It's someone who really can help you and ultimately help the student get their highest potential. It's important to remember that every traumatic brain injury is different. Every student will respond differently, every parent will respond differently, and no intervention plan will work the same. The most important thing when dealing with a student with a traumatic brain injury is to have patience and be flexible and not be afraid to change up interventions or see what's working and what's not, constantly reviewing and having those evaluating of each student's case and their 504 plan is very important, and that can contribute to a student's success. Here are a couple references that I used for this presentation, and I hope you enjoyed learning about traumatic brain injuries and their importance in the educational setting and how a counselor can really help a student become more successful. Thank you so much.